Now, allergy season is in full swing, and according to weather.com, this allergy season will be brutal. So here to help us figure out how to fight those itchy eyes and runny noses, we have physician and health expert Dr. Jennifer Caudle with us. So Dr. Caudle, thank you for being with us.
Thanks for having me.
All right, so come on, this is the worst time of year for so many people. Is it going to be horrendous this year?
Well, you know, I'm a family doc. I'm in the office every day of the week, and I have to say that every day lately I'm seeing a number of cases of allergies. I would say it's pretty moderate, so people really are experiencing these allergy symptoms now.
So in terms of how you know that you have allergies as opposed to just, say, a common cold, I mean, you know, what are the differences in terms of symptoms?
Absolutely. Well, so let's talk about the symptoms of allergies, period. Okay, so if you've ever, I don't know, do you have allergies?
No, I feel like I'm terrible because I see other people suffering and I don't tend to get them. Although I have to say that there are certain times of the year when the pollen count is kind of crazy that I get, you know, the kind of itchy nose and it drives me crazy. But I definitely don't suffer like some people do.
Understood. Well, you actually mentioned one of the symptoms. So like talking about them, people sometimes get itchy or watery eyes. They'll get nasal congestion, a stuffy, runny nose. They might get like an itchy nose, sneeze a little bit, some cough, a little bit of sore throat. So you say, well, how do we know that this is not a cold, right? Because a lot of these symptoms could be cold symptoms. So there are a couple ways. So let's go through those. First of all, if you have allergies, you're not going to have a fever like you do sometimes with a cold. That's really important to keep in mind. And you know, sometimes when we get colds, we get muscle aches and pains and we're feeling really just out of it and blah. You're not really going to get those muscle aches and pains with allergies. Keep in mind, allergies may last the entire season that they come on, whereas a cold maybe a couple weeks at the most. And allergies can come on pretty quickly, whereas colds sometimes take a few days to kind of rev up and come on.
All right, so you said that sometimes it can last the whole season, which is just awful for people that suffer with them. So, you know, what can we do? What can you best do if you are somebody who's prone to suffering from allergies? What are the best ways of fighting it?
Well, I'm a fan of prevention. There are medications that will treat it. We can talk about that, but let's talk about prevention. First thing is know what the pollen counts are. There's actually really cool websites out there that you can go on and say, okay, what's the pollen count? I have to be outside. Let me see what's going on. So you can check the counts to see what's going on. And remember, allergies and the seasonal allergies are most commonly caused by things like pollen, ragweed, mold, trees. So that pollen count really matters. But prevention, keep those windows closed, right? This is the season where we want the windows up because it feels so nice. Well, maybe not later.
Maybe not right in New York right now, but it will be feeling nice eventually.
Right?
Yeah.
But it'll feel warm, but keep the windows closed because that pollen's going to come right in. If you have to be outside, make sure you rinse off when you come in. And let's say you have to cut the grass, maybe not so much in New York City, but in other parts of the country, you got to be out there doing some yard work or whatever. Make sure you wear a mask to keep that pollen low.
So talk to me a little bit about things in terms of treatment. You know, people use eye drops, for example. People take things like Benadryl. What are the most effective treatments out there?
There's a lot of great treatments, and many of them are over the counter. There's prescription and over-the-counter treatments. I'd say the main classes are pills, right? So you can take a pill antihistamine, other medications that are pill form. You can also do like a nasal spray. There are like saline nasal sprays or steroid nasal sprays. And then there are the eye drops that you mentioned, like antihistamine eye drops and others. So there's 3 different types of medications that we can use. It's really important to see your doctor because then you can kind of figure out which one's right for you. They might prescribe them, they might have you get them over the counter, but allergies can be treated. I have to say, if I want to give one message here, there is a message of hope because allergies can be treated.
Yeah, and which is nice because it's nice to have some hope when people suffer so terribly with allergies.
They can be horrible. They can make
really
you tired
terrible.
and just feeling, you know, not good.
Just feeling a bit crappy, basically.
Yeah,
so
basically.
What about allergy shots, though? I mean, you know, is this kind of the fail-safe thing? Should everybody who's suffering with allergies get that at the beginning of the season, and will that keep them clear throughout the season?
That's a really good question. So allergy shots is not necessarily the option for everyone, but there's a large number of people that may need allergy shots. Usually when I'm thinking about allergy shots for someone is when maybe they're not doing so well on the medications, it's not holding their symptoms. I really want to get them to an allergist, to a specialist, and have allergy testing. We can see what you're allergic to. We can test for that with blood tests and skin tests. And then yes, some people are eligible for allergy shots to kind of help keep these allergies at bay. So that's an option. That's another thing. You know, as a family doctor, I'm a big proponent of, you know, being an advocate for your health. And if you feel like the meds you're taking and the advice you've been given is not working, remember there's often another step, and that's often when we think of allergy shots.
Yeah, and you can also reach out, I guess, to your healthcare provider and say, hey, this isn't working for me.
Help
what
me.
will work for you? Exactly.
Help me.